Panic disorder is an acute anxiety disorder characterized by recurrent autonomic nervous symptoms such as palpitations, sweating, and accompanied by a strong sense of dying or losing control, and the fear of having an unfortunate outcome. Panic symptoms is self-fulfills. In some cases, patients with sudden panic, the collapse of the sense of out of control, crazy feeling as if death will come.
Panic disorder can be caused by genetics such as our vulnerability towards stress, which is the tendency to be generally neurobiologically overreactive. And some people are more likely to have an emergency alarm when they are confronted with stress-producing events. So next, we will look into what are the diagnostic criteria for panic disorder. The first diagnostic criteria is recurrent unexpected panic attacks are present. The second one is at least one of the attacks are followed by persistent concern or worry about additional panic attacks or their consequences, or a maladaptive change in behavior related to the attacks, or both for 1 month or more. The third diagnostic criteria is the disturbance is not related to any physiological effects of substance such as drug abuse or medications. And the last one is the disturbance is not better be explained by any other mental disorder such as social anxiety disorder.
A large number of medication that influence the neurotransmitter system of noradrenergic, serotonergic, or GABA, benzodiazepine, or any combination tend to be successful in treating panic disorder. Currently, SSRIs are the suggested panic disorder medication, and high-potency benzodiazepine widely used for panic disorder. Next method of exposure-based therapies is to coordinate circumstances under which the patient will gradually face the circumstance fear and realize that there is nothing to fear. And PCT focus on exposing the cluster of interoceptive stimuli that remind patients with panic disorder of their panic attacks. Cognitive therapy is also given for patients. Combined treatment was no better than individual treatments. Patients on medication, whether or not paired with a CBT, had somewhat declined, and much of their benefit were maintained by those receiving CBT without drug.
Panic disorder is fairly common. Approximately 2.7% of the population meet criteria for panic disorder during a given 1 year period. Onset of panic disorder usually occurs in early adult life from mid-teens through about 40 years of age. The median age of onset is between 20 and 24. Last, most initial and unexpected panic attack begin at or after puberty.